research gaps to strengthen your objectives. Over to you, ma'am.
Good morning to all of you, and thank you so much. Thank you so much, Dr. Sumit and Dr. Nivedita, for inviting me for this very important workshop. I think this is one very important workshop that was needed long time back, and I think this is one of the first such workshops being done in ICMR, because we've been reviewing a lot of proposals, and people don't know how to submit the proposals, what objectives to follow, all that. So I think this is a very significant work that you are doing. So my topic is on identifying research gaps and review of literature. Thank you, Dr. Jayashree, for setting the ball rolling, talking about research questions. And what I want to show here is that before we actually frame a research question, it is necessary to identify the research gap. Research question comes after you identify the research gap. So what is a research gap? What is a research gap? It's a gap in the knowledge. It is something that is missing. It's something that we don't know yet. So if whatever knowledge is available in the form of literature in a particular domain or in a particular area that you are working, there is a problem that still remains unanswered, and literature or existing studies have not addressed that problem adequately, or there is something that still needs to be explored. If such is the situation, such is the event that is happening around us in a scientific sector, then I think we have to look at that, understand that gap, and then try to frame our research question. The research gap could be absolutely a new concept or a new idea that has never been addressed by anybody. It could be something that is existing. People have done research on that, but it still needs to be updated. It's an outdated research, and we need to update it. And it could be also possible that this research has been done on a specific population, and if the same thing has to be replicated in another population group or in another regional setup or in a geographical location, probably that could be a gap which a researcher can take up and then frame his research question appropriately and start research on. So primarily research gap is a situation where there is significant scope for more research. Now, talking about some examples here, we all know that a lot of work has been going on in COVID-19 vaccines, but still there is a gap in understanding the long-term effects of COVID-19 vaccines. And a researcher may take that as a research question and start working on that. Or it could be that somebody came to me yesterday and he said that a lot of omic studies have been done on determining the severity of COVID-19 in COVID patients, and one would like to generate evidence and synthesize existing evidence to see how many of them are actually determining the severity of COVID-19 or not. So that is a research gap that people have not addressed. We have looked at literature and we find that nobody has tried to synthesize evidence from such studies. So it could be a topic that could be taken up for research. So talking about research gap and research problem, as Dr. Jayashree had mentioned, that a research question or a research problem or a research aim is a definite statement that talks about the area of work that the researcher is interested in, and it should be able to give us a meaningful understanding and a detailed investigation procedure. But it is different from a research gap in the sense that first a researcher has to identify a research gap, and then only he should state his research problem. And talking about the function of a research gap and a research problem, research gap identifies research in the knowledge, whereas a research problem identifies the need for doing that research, articulates that need for research. So that is the difference between the two. So talking about research proposals, as we've been listening since morning, that research proposals have been submitted in STI, but as a reviewer, I would look at the research proposal and try to see I will read the first section of the research proposal, the introductory section, and see whether the researcher has clearly articulated the research gap or not, and the need for doing his research. If that is not clear, many times the reviewers reject the proposals, because if the researcher is not clear about the kind of research that he is going to do, that means his research is not going to give the benefit that he is looking for. Now, why is it essential to identify the research gap? One, because it ensures that the researcher has already read a lot about it, he has a deep knowledge about the subject in the area that he is going to work, he or she is going to work. It also ensures that the research study is innovative, it has some unique characteristics, and it is original. It avoids duplication, because many other, if you don't read literature, then it might be possible that you're doing something new, you're reinventing the wheel. It also ensures that you start the work at some point of time, because you don't have adequate knowledge on the work that you're planning to do. At some point of time, you might need some revision in the proposal, in the research activity. So it ensures that there is no major revision in the research work that you start once. And last but not the least, it is publishing. So it is very essential to identify the research gap in the beginning itself. How to identify the research gap? So starting with the topic, the researcher should be, first of all, passionate about the work that he is going to do. He should be able to love what he wants to do. That is the primary thing. And then, based on his passion and his interest in that topic, he should choose a key motivating issue. Some question that is motivating, something that is interesting, not only for him, but also for the larger scientific community. And then draw inspiration from published literature, keep reading literature, and then also follow the mega trends. You see, look at conference proceedings, look at stakeholders meetings, and read experts' views about the topic that he is interested to see how many of what has been done and what has not been done. And he should also think about a research topic which is timely, which is needed, and also something that requires urgent attention. So it should not only be timely, but it should also be necessary. So I'll just click on this literature here. So I am showing you this paper where we remember when the COVID pandemic started, at that point of time, many groups were starting with different types of mathematical models to predict the disease, right? There were different types of models on transmission, different types of models on detecting the infection rates. You see, so a lot of models were coming at that point of time. We wanted to know what these models are, how important and how significant are these models in predicting the disease. So it was very essential at that point of time to know the models that were published by different researchers and what exactly are they telling you. For a common man, what does it tell you? So this project we had planned at that point of time to synthesize evidence from different types of models and do a systematic review to see what mathematical models COVID-19 Indian researchers have come out with and how do they generate evidence. So this was a timely project at that point of time for us, and we did that also, and now it is in the publication stage. So then once you have identified the research topic and the research area of work, then you go into the reviewing of literature to see what has been done by different researchers and where are the gaps. Very important that a researcher should read and read. And once you start reading, you examine the introduction section and see what are the reasons for the research for that particular, by that particular author or that particular researcher, what are the conclusions that we have drawn from his research, and where are the suggestions for future research. It also gives you the idea about focus, which area should one focus on. And then it is essential for a researcher to go through the limitation of the research paper and try to assess the recommendations for future directions in that paper. You should read systematic reviews because systematic reviews give you and provides you a summary of existing literature, take stock of existing literature, and then sometimes what happens when you keep on reading papers, then you will realize that the areas of work that you are interested in, it is published in certain number of journals only. Certain journals, they publish it more. So you may like to go to the most prominent and influential journals and look at them in detail. And in every journal, there is something called the key concept section. The key concept section is written by the experts in that field, experts in that area. One can go through that and then get future directions for their research. Now, the different research gaps that you see in literature could be due to various reasons, or it could be different types of research gaps. The research gaps could be due to insufficient research. Insufficient research means the research would have been done in a specific population group, maybe in an adult group, and you may like to repeat the same kind of research in a different population group. Or it could be that it has been done in a different geographical area, and you may like to do the same because the research idea as such has meaning to your area or your geographical regions also. So you may like to do or repeat the same exercise in a different geographical area. So there could be gaps in this literature, and we'll see some examples here as to what it could be. Methodological gaps also. Some people would have adopted a different methodology, and you may like to do it with a different methodology and look at the same research question again. So there could be these gaps, and I'll give you some examples here. So looking at this example, so if you look at this example, this is a paper that has been published in Lancet on clinical and economic burden of drug susceptible tuberculosis in Indonesia. This is a national trend study from 2017 to 2019. So as a researcher, I would like to read this paper and try to identify the research gap from this paper. You all know that a Lancet paper always gives you the evidence till now. Next, please. So if you look at the evidence before this study, it gives you in detail yeah. So if you look at this, these studies, they have looked at several studies. They say there are 235 studies identified, and 11 were considered suitable and related to notified drug susceptible tuberculosis. And then if they further state in this evidence that these studies analyze the burden of tuberculosis regionally at the province or district level and or at a city level. That means they have not done this analysis at a national level. So that is the reason for them to do it at a national level. And they have also stated in this paper that how will this study add value to the research question. So all that that information is available in the paper, and a researcher has to first go through this and then identify the research gap. I'll show you another paper where you're talking about another type of research gap. Yeah. Yeah. So this is the paper on determining the disability rate for 2018. So the study has been done in 2 states in India, and that is actually following a technique which is different from the global burden of disease technique. You must have all heard about GBD techniques, and the GBD establishes the disability weights for individual diseases based on a criteria and a methodology. Now, this study has been done on a different methodology, and here the authors have clearly stated why there was a need for doing this kind of a study and what is the rationale in the studies that have been done till now, the GBD studies, and what makes this study relevant for today's situation. So this is given in the introduction part itself. If you look at the introduction here, yeah. However, even over the years, the weights derived from the various GBD studies lack representativeness of the socially and educationally vulnerable populations. So here we are talking about, because the GBD studies, they have followed, they have done this analysis on a group of people who are already educated, right, in a higher economic status. But suppose we want to do a burden of disease estimates on vulnerable populations, on general populations like the populations in India, then it is very essential to replicate the same analysis on our population, right? So the methodology adopted by them would be something that is not replicating. So we would like to do an easier methodology on our general population and see how different they are from the GBD estimates. So this study also in detail gives you the information why there was the need to do the study. So that is one type of research gap. The research gap could also occur due to some controversy or lack of clarity in understanding. There would have been a lot of studies that have already been done, but still there is a lack of the understanding on the subject that is of interest. So in such a case also, the researcher would like to address that gap and do a new study and look at those gaps and try to address them. Maybe here is an example I show you. Yeah. So we all know that multimorbidity is a very important condition that needs to be addressed, right? And multiple long-term conditions is also a very important topic that needs to be addressed. But here, when you look at this paper and you read this paper, you go to the end of the introduction section. Here, the author has clearly defined why there is a need and what is the lacunae. What was the need for doing this kind of a study? Because there is a difference in the case definitions of multimorbidity by different. Many papers have been written, but the definitions are very different. The reporting methods have been very different, and the methodology of determining multimorbidity is also. So it is very essential to look at that and then do the new research. And then another thing is that there is enough of work, but there are limitations of the existing research work. There could be limitations in terms of the small sample size. The studies would have been done on a smaller group of people, and one would, or it could be that it is something that has never been addressed by the researchers, and this new researcher would like to address that gap. If that is the case also, then you will do some new research. Here again, I am showing you some examples. Yeah. So this study is on extreme horseshoe and ecumenal anal fistula. There is a challenges in diagnosis and management. So here the author clearly states that this kind of a description of study has never been done before by any other researcher in this area, and therefore he is doing a descriptive study and trying to characterize, describe the characteristics and management of such fistula. So that was the reason for this researcher to do the study. He's already taken stock of the existing work by different researchers, and then he states that in the introductory part of the paper. Now, yet another example where it's so this study is on pulmonary function of 3 to 5 months after hospital discharge for COVID-19. This is a single center cohort study. And if you go down in the introductory section, the authors clearly state why there are a number of studies on the frequency and relevant predictors of COVID-19 related pulmonary sequelae, and it is still limited with varying results. Studies are restricted by small sample size, lack of systematic recruitment, or an assessment of pulmonary function within 0 to 6 weeks after discharge. So this is the reason for him to take up the new study. And last but not the least, there are problems which have still not been resolved by researchers, and the researcher wants to do it as a new or a novel kind of work. And there again, there are information which is not available, and such studies are going to be the practically oriented research topics which have never been done before. They are considered to be most innovative, and they will have a higher chance of getting funding by the funding agencies. So the challenges in identifying the research gap, we all know that is, we'll have to read a lot. Huge amount of information is already available, and we have to read a lot, and we have to organize our literature reviews in a manner in which, in a systematic manner in which you can go back and refer to it whenever you want to. So how do we do that? There are methods of doing it. One is that you resort to digital tools, right? So what you do is, when you have identified a research question or a research gap, and then you frame a research question to look at it and understand and get more knowledge about that topic, it is essential to use some digital tools, because it is not always possible to read all the literature available on a particular topic. So these are some of the digital tools that are available. Thomson Reuters gives the essential science indicator that informs about the different papers, the different experts in that area, the institutes who are working in these areas, and the countries who are driving this area. So you can go through essential science indicators to understand more about this, and then Google Trends. Google Trends gives you the popularity or the interest by different groups of researchers. It provides you the regional interest, the geographical interest, and it also provides you the related searches by different other researchers. So you can use these tools also. And if we are if we want to know the initial work that researchers have been doing in that area, then you can go to medRxiv and get the preprints of certain papers that are yet to be published. But the conceptual part can be read from these papers, and then you can build upon your research based on these concepts. And if you are interested to do it for a biostatistician, one can also go through a for a biostatistician who is purely interested in doing biostatistical research, there is a website called Cobra. This is the top. Yeah, this is a collection of biostatistical research studies that have been done by different researchers, and then you can build upon research based on these topics also. Okay. So next we come to the different types of literature review methods. So the three major types of literature review methods are the rapid reviews, the systematic reviews, and the scoping review. So I will not go into the details of each of them, but I'll just explain to you about the different types of reviews. One is the rapid review. What is a rapid review? Rapid review means an accelerated review, right? So it's an accelerated method of synthesis of evidence from primary studies. So how accelerated it is? If you are thinking about a systematic review, it will take about 1 to 2 years to complete your entire systematic review. Whereas a rapid review has to be done rapidly. Why? Because it is generating evidence from a rapidly changing field, and it is primarily used as a guide for decision making. So therefore, it has to be done in a short period of time. About 6 to 8 weeks can be used for doing that. And because of the time constraints, because of the resource constraints, and because of the because there are no methodologies available for a rapid review in that sense, there is a possibility that the rapid reviews could give you less evidence as compared to a properly conducted systematic review. However, if a rapid review is, because there is no delineated methodology for conducting a rapid review, you can follow the core principles of doing a systematic review, so that the evidence that is generated from this rapid review is a good evidence for a researcher for conducting future research. So you see on the right hand side, during 2020, there has been a sudden increase, 100 times increase of doing rapid reviews, because it was the time of the pandemic and people wanted to get quick solutions to research questions, and therefore a lot of rapid reviews have been published in the journals. Now, what is a systematic review? A systematic review is an investigation of a clearly formulated research question. The way Dr. Jayashree had mentioned that you should have a 5 course in a systematic review, and it uses methodological techniques and explicit methods to identify, select, and critically appraise each of these articles that or evidences, pieces of evidences identified by the researcher included in the systematic review. And then there is a method for analyzing the data from using appropriate statistical techniques. The process is nothing but, first of all, formulate a research question, then set up an inclusion-exclusion criteria, create a search strategy, improve upon the search strategy by testing it on a set of studies, and then adding and refining more terms to it, and create synonyms for the search terms, and then extract important information from individual studies and use statistical methods to analyze the quantitative information extracted from these primary studies. To get more details about this, I will direct you all to download this book that has been published by ICMR, three of us in ICMR, and it has come as an ICMR book on beginner's guide for meta-analysis and systematic reviews. You can download it, it's free of cost, and it gives you a step-by-step method of doing systematic review and meta-analysis. It gives you all details and you can read this book. Now, what is a scoping review? Scoping review is something that you do before you do a proper systematic review. It is a review which is exploratory in nature, and it systematically tries to map the literature on a particular topic and then identify the different concepts and where are the sources of evidence, what are the databases. And it helps you in understanding the phenomena of interest, the domain of interest, and evaluate where exactly the research has been done and where are the gaps. And it is more qualitative in nature than quantitative. There is another method, and that has been in use quite recently, and that is called the evidence gap map. Now, what is an evidence gap map? So whatever we've learned till now, rapid review, systematic review, they are approaches which needs lot of work, and it needs a team of researchers to do it. But an evidence gap map is more easy to understand. It gives you a visual matrix of the available evidence till now in terms of literature or in terms of published literature, and it also maps it in an XY coordinate to show you visually where are the evidence gaps. And a researcher can create an evidence gap map for any particular topic. If it is an intervention study or it could be an observational study, and try to identify and map them as per the methodology, and then the gaps can be clearly identified. You can straight away go into those gaps and start working in those domains. So here is an example. I don't know how clear it is, but what it's trying to see is it has created an evidence gap map on child well-being interventions in LMICs and associated products. So this is not very clear, but what it tries to see, the bigger circles actually give you enough of evidence already available on antenatal care and postnatal care by TBA and SBA people, and it talks a lot about mortality. It has enough of evidence on morbidity and less of evidence in disability and childhood illnesses, And if you go through this map, you see at the end there are less and less of evidences available. So it gives a pictorial depiction of the evidence available to you and where are the gaps where in which the researchers can move and start working. Now, to conduct a literature review, we all know that you have to develop a clear-cut question, prepare a search strategy, create an inclusion criteria, plan test searches, and refine your research terms again and again. Look for databases, and then all that is done by you in a proper systematic. How does one do that? You have to write it down, whatever search strategies you have adopted, you write it down, the synonyms, everything has to be documented properly. And it helps in preventing duplication and helps in synthesizing available information in a documented manner. And if a researcher stops working at a particular stage, the next researcher can just take it forward from there instead of reinventing everything. It gives you valuable insights on the study in terms of the methodology. The methodological aspects can be clearly defined in a literature search, and it identifies gaps and weaknesses in the existing search. So there are different types of searches in different databases. The databases could be bibliographic or general databases like the Scopus, the Embase, the Google Scholar, where the user has to just browse for a popular article based on the search, and he will start getting the articles. Or it could be publisher databases in journal websites like the Elsevier, the Springer, the Taylor and Francis, the online Wiley library, Oxford journals. You can go to the individual journal websites and search for those articles. Or it could be subject-specific databases, because there could be somebody who wants to do something in psychology, so he may have to look at those databases and search for the relevant articles. So ultimately, what you have to do is that once you have the articles, you have to do a backward searching and a forward searching. Look through the reference lists available of the relevant articles, as well as look for citations which have referred to this article. So this is backward and forward searching. Keep a record of all the searches so that you have the list of keywords and the keyword combinations that you have used to search these articles, and also the list of relevant and potential journals which can provide you those primary studies. Use a reference manager. A researcher should use a reference manager like Zotero or EndNote or Mendeley. Mendeley and Zotero are free of cost. You can use a reference manager and keep a track of all the references that he has searched, and then keep up with the literature by generating alerts for yourself. It could be table of contents alerts, or it could be citation alerts, it could be semantic scholar alert, it could be a Google Scholar alert. To keep up to date with literature using these alerts. And then the researcher who identified the gaps, he can also look at conference proceedings to find out the latest findings and discussions on the topic. You can look at unpublished clinical trials. Cochrane sometimes gives you a list of unpublished clinical trials also, and then look at thesis, dissertations, and working papers to understand the kind of work that other researchers are doing. With that, I think I stop here. I think if you have any questions. Then unpublished